Question 1. A phlebotomist is drawing blood from a patient and notices the patient's arm is swelling rapidly at the venipuncture site. What is the most appropriate initial action? A. Apply a cold compress to the site. B. Remove the tourniquet and needle immediately. C. Ask the patient if they are experiencing pain. D. Continue the draw but reduce the vacuum. Answer: B. Remove the tourniquet and needle immediately. This question tests your immediate response to a complication during venipuncture, specifically the formation of a hematoma, which is indicated by rapid swelling. The crucial keyword here is most appropriate initial action. When swelling occurs, it indicates blood leaking into the tissues, so the first and most critical step is to stop the blood flow by removing the tourniquet and needle to prevent further extravasation and reduce pressure. For instance, if you see the arm puffing up while the needle is in, quickly taking out the needle and tourniquet is your priority to minimize the bruise. Always remember, patient safety and minimizing harm are paramount, so discontinue the draw at the first sign of a significant complication like a hematoma. Question 2. A phlebotomist needs to collect blood from a 2-year-old child for a CBC and a glucose test. Which site is most appropriate for a capillary collection on this patient? A. The middle finger of the dominant hand. B. The plantar surface of the heel. C. The thumb of the non-dominant hand. D. The earlobe. Answer: B. The plantar surface of the heel. This question focuses on appropriate venipuncture sites for pediatric patients, specifically capillary collections in infants and toddlers. The keyword 2-year-old child is crucial because for children under 1 year old, or those who are not yet walking, the heel, specifically the medial or lateral plantar surface, is the preferred and safest site for capillary punctures. Using a finger on such a young child is not recommended due to the risk of bone injury and the small size of their fingers. For example, when collecting a heel stick, always ensure the stick is on the outer edges of the heel, avoiding the center which contains major nerves and arteries. Always prioritize the safest and most appropriate site for the patient's age to prevent injury. Question 3. Before performing a venipuncture, a phlebotomist must allow the antiseptic to air dry completely. What is the primary reason for this crucial step? A. To prevent the antiseptic from causing hemolysis of the blood sample. B. To ensure maximum bactericidal action and prevent contamination. C. To avoid patient discomfort from a stinging sensation. D. To allow for proper needle insertion without slipping. Answer: B. To ensure maximum bactericidal action and prevent contamination. This question addresses a fundamental aspect of infection control in phlebotomy: antiseptic application. The keyword primary reason emphasizes the most important purpose of allowing the antiseptic to air dry. Antiseptics like alcohol need time to kill microorganisms on the skin surface. If not given enough time to dry, their bactericidal action is incomplete, increasing the risk of introducing bacteria into the bloodstream or the blood sample. For instance, swabbing an arm with alcohol and immediately sticking the needle in means the alcohol hasn't had time to effectively clean the skin, potentially contaminating the blood culture. Always remember that a fully air-dried antiseptic is essential for a clean and sterile venipuncture site. Question 4. A patient faints during a blood draw. After removing the needle and tourniquet and assisting the patient, what should the phlebotomist do next? A. Document the incident in the patient's chart immediately. B. Offer the patient a glass of water. C. Apply an ammonia inhalant under the patient's nose. D. Call for emergency medical assistance. Answer: A. Document the incident in the patient's chart immediately. This question tests your knowledge of post-fainting procedures and prioritization in a medical setting. The keyword next is vital, indicating the immediate follow-up action after ensuring the patient's safety. While offering water or calling for help might be subsequent steps depending on the patient's recovery, documenting the incident thoroughly and promptly is a critical legal and medical requirement. For example, if a patient faints, after getting them safely to the floor and removing the needle, the very next step is to record exactly what happened, when, and what actions were taken, which is crucial for patient care continuity and legal protection. Always ensure proper and timely documentation for any adverse event during a procedure. Question 5. Which of the following is the correct order of draw for a venipuncture collection if a phlebotomist needs to collect a blood culture, a light blue top tube, and a lavender top tube? A. Light blue, lavender, blood culture. B. Blood culture, lavender, light blue. C. Lavender, light blue, blood culture. D. Blood culture, light blue, lavender. Answer: D. Blood culture, light blue, lavender. This question directly tests your knowledge of the critical order of draw, which is designed to prevent cross-contamination between additives. The concept is sequential filling to ensure accurate lab results. The proper order of draw dictates that blood cultures, sterile specimens, are always collected first to prevent contamination, followed by tubes containing citrate, like light blue tops for coagulation studies, and then tubes with EDTA, like lavender tops for hematology. For example, if you need these 3 tubes, you'd collect the blood culture bottles first, then the light blue tube, and finally the lavender tube to maintain specimen integrity. Always prioritize sterile collections first, then coagulation tubes, and then other additive tubes to prevent carryover contamination. Question 6. A phlebotomist is preparing to draw blood from a patient with an 4 line in the left arm. What is the most appropriate site for venipuncture? A. Distal to the 4 in the left arm. B. Proximal to the 4 in the left arm. C. The right arm. D. The left hand. Answer: C. The right arm. This question assesses your understanding of safe venipuncture practices when a patient has an 4. The critical clue is 4 line in the left arm, which means that arm should generally be avoided for venipuncture to prevent diluting the blood sample with 4 fluids or risking infection. The most appropriate and safest site is typically the opposite arm, as it is free from the 4 line and its potential complications. For example, if a patient has an 4 drip running in their left forearm, you should always look for a suitable vein in their right arm for your blood draw to ensure an accurate specimen. Always choose the arm without an 4 whenever possible to avoid inaccurate test results or patient harm. Question 7. A phlebotomist accidentally sticks themselves with a contaminated needle. What is the immediate first action they should take? A. Report the incident to their supervisor. B. Wash the exposed area with soap and water for at least 30 seconds. C. Squeeze the wound to promote bleeding. D. Apply an antiseptic wipe to the puncture site. Answer: B. Wash the exposed area with soap and water for at least 30 seconds. This question addresses crucial post-exposure procedures in phlebotomy, specifically what to do immediately after a needle stick injury. The keyword immediate first action is key here, emphasizing the priority. The very first step after a needle stick is to thoroughly wash the puncture site with soap and water for a minimum of 30 seconds to physically remove as much contaminants as possible, even before reporting the incident. For instance, if you get stuck, run to the nearest sink and vigorously wash the area right away. Remembering this primary immediate action is vital for minimizing the risk of infection after an exposure. Question 8. Which of the following conditions would contraindicate drawing blood from a patient's arm? A. The patient has a mild rash on their forearm. B. The patient has a history of fainting. C. The patient has a dialysis shunt in that arm. D. The patient is receiving 4 fluids in the other arm. Answer: C. The patient has a dialysis shunt in that arm. This question tests your knowledge of contraindications for venipuncture, which are conditions that make a procedure unsafe or inappropriate. The critical clue is contraindicate drawing blood from a patient's arm. A dialysis shunt, also known as an arteriovenous fistula or graft, is a surgically created connection between an artery and a vein, essential for dialysis treatment. Drawing blood from an arm with a shunt can damage the shunt, compromise its function, or cause serious complications for the patient. For example, if a patient points out a raised area under the skin and mentions it's for dialysis, you must avoid that arm entirely, even if there's a visible vein. Always respect and protect a patient's access sites for critical treatments like dialysis. Question 9. A phlebotomist is collecting a blood sample for a cold agglutinin test. How should the specimen be handled immediately after collection? A. Placed on ice. B. Warmed to 37 degrees Celsius. C. Protected from light. D. Centrifuged immediately. Answer: B. Warmed to 37 degrees Celsius. This question assesses your understanding of special specimen handling requirements for specific tests. The concept here is maintaining the viability of certain antibodies. The key term cold agglutinin indicates that these antibodies react with red blood cells at cold temperatures, causing them to clump together. To prevent this clumping and ensure accurate test results, the specimen must be kept warm, at body temperature, 37 degrees Celsius, immediately after collection and during transport to the lab. For instance, after drawing blood for a cold agglutinin, you might place the tube in a heel warmer or a warm water bath to keep it from cooling down. Always remember that cold agglutinin samples require warmth to prevent interference with testing. Question 10. A phlebotomist has just performed a venipuncture. The patient begins to complain of sharp, radiating pain down their arm. What complication is most likely occurring? A. Hematoma formation. B. Syncope. C. Nerve involvement. D. Hemolysis. Answer: C. Nerve involvement. This question evaluates your ability to recognize and differentiate between venipuncture complications based on patient symptoms. The key phrase is sharp, radiating pain, which is a hallmark symptom of nerve irritation or injury during a blood draw. Unlike a hematoma, swelling/bruising, syncope, fainting, or hemolysis, breakdown of red blood cells, often asymptomatic to the patient at the time of draw, nerve pain typically presents as sudden, severe, and radiating discomfort. For example, if the patient says they feel an electric shock or pins and needles shooting down their arm, it strongly suggests the needle touched a nerve. Always stop the procedure immediately if a patient reports sharp, radiating pain to prevent further nerve damage. Question 11. Which piece of personal protective equipment, PPE, should a phlebotomist don last when preparing for a venipuncture? A. Gown. B. Mask. C. Gloves. D. Face shield. Answer: C. Gloves. This question tests your knowledge of the correct order for donning personal protective equipment, PPE, which is crucial for infection control. The concept is to protect yourself from contamination in a sequential manner. Gloves are always donned last because they are the barrier directly touching the patient and the specimen, and they must remain clean until the procedure begins. For example, you would put on your gown, then a mask or respirator, then eye protection like a face shield, and finally your gloves right before touching the patient or equipment. Always remember that gloves are the last item of PPE to be put on, ensuring the cleanest possible direct contact. Question 12. A phlebotomist is performing a capillary puncture on an infant's heel. The infant suddenly pulls their leg away, causing a superficial scratch. What should the phlebotomist do immediately? A. Continue the collection on the same site quickly. B. Apply pressure and a bandage to the scratch. C. Reposition the infant and attempt the puncture on the other heel. D. Document the incident in the patient's chart. Answer: B. Apply pressure and a bandage to the scratch. This question assesses your immediate response to a minor injury during a capillary puncture. The key here is superficial scratch and immediately. Your first priority is to address the patient's injury. Just as you would with any bleeding wound, apply pressure and a bandage to stop the bleeding and protect the scratch before considering another collection site or documentation. For example, if the baby jerks and scrapes their heel, quickly grab gauze and apply pressure to the small scratch. Always prioritize the patient's immediate safety and care for any injury before anything else. Question 13. Which of the following actions is a violation of HIPAA? A. Discussing a patient's lab results with the ordering physician. B. Sharing a patient's diagnosis with a colleague who is not involved in their care. C. Providing a patient with a copy of their own test results upon request. D. Reporting a communicable disease to public health authorities. Answer: B. Sharing a patient's diagnosis with a colleague who is not involved in their care. This question centers on HIPAA, Health Insurance Portability and Accountability Act, and patient privacy. The core concept is protecting protected health information, PHI. The keyword violation of HIPAA directs you to identify an action that compromises patient confidentiality. Sharing a patient's diagnosis with someone not directly involved in their treatment violates the minimum necessary standard and the principle of patient privacy. For instance, if you overhear a coworker discussing a patient's sensitive medical condition with another staff member who doesn't need to know, that's a HIPAA breach. Always remember to only discuss patient information with individuals who have a legitimate need to know for the patient's care. Question 14. A phlebotomist has just collected a blood specimen that requires centrifugation. How long should the specimen be allowed to clot at room temperature before centrifugation? A. Immediately. B. 5 to 10 minutes. C. 15 to 30 minutes. D. 1 hour. Answer: C. 15 to 30 minutes. This question tests your understanding of proper specimen processing, specifically the clotting time for serum tubes. The concept is that blood needs adequate time to form a stable clot before it can be centrifuged to separate the serum. The keyword clot at room temperature highlights this critical step. Most guidelines recommend allowing serum tubes, e.g., SST, red top, to clot for 15 to 30 minutes at room temperature before centrifugation. For example, after collecting a red top tube, you would place it in a tube rack and set a timer for at least 15 minutes before taking it to the centrifuge. Always ensure proper clotting time to prevent fibrin formation and ensure accurate test results. Question 15. When performing a venipuncture, a phlebotomist inserts the needle at a very shallow angle, less than 10 degrees, and only a small amount of blood enters the tube, then stops. What is the most likely cause of this complication? A. The needle went through the vein. B. The needle was not inserted deep enough. C. The vacuum in the tube was lost. D. The tourniquet was applied too tightly. Answer: B. The needle was not inserted deep enough. This question presents a common venipuncture complication and asks for its most likely cause. The key phrases are shallow angle and only a small amount of blood enters the tube, then stops. If the angle is too shallow, the needle might only partially penetrate the vein or barely nick the top surface, causing minimal or no blood flow before stopping. For example, if you insert the needle almost parallel to the skin, you might only get a flash of blood or just a few drops, indicating the vein wasn't fully entered. Always ensure the needle is inserted at an appropriate 15 to 30 degree angle to fully access the vein lumen. Question 16. A phlebotomist is preparing to draw blood from an outpatient. Which information is considered primary identification for the patient? A. Patient's verbal statement of their name and date of birth. B. Patient's insurance card. C. Patient's address and phone number. D. Patient's physician's order form. Answer: A. Patient's verbal statement of their name and date of birth. This question focuses on the crucial step of patient identification, a core safety procedure in phlebotomy. The concept is that two unique identifiers must be used to confirm patient identity, and typically, the patient's full name and date of birth are considered primary. The keyword primary identification emphasizes the essential elements for confirming who the patient is. While other information might be part of their record, obtaining a verbal confirmation of their name and date of birth directly from the patient or their guardian is the most direct and reliable method. For example, when you greet a patient, you'd ask, "Can you please state your full name and date of birth?" and compare it to their armband or requisition. Always use at least two identifiers to prevent misidentification errors. Question 17. A phlebotomist receives an order for a fasting blood glucose test. The patient states they had a small cup of coffee with cream and sugar an hour ago. What is the most appropriate action? A. Proceed with the draw as scheduled, as coffee does not affect glucose. B. Advise the patient that the test cannot be done and reschedule it. C. Note the coffee intake on the requisition and proceed with the draw. D. Instruct the patient to drink a large glass of water and wait 30 minutes. Answer: B. Advise the patient that the test cannot be done and reschedule it. This question assesses your understanding of fasting requirements for specific tests. The concept here is that ingesting anything other than water can significantly alter the results of a fasting blood glucose test. The keywords fasting blood glucose and coffee with cream and sugar are crucial clues. Cream and sugar contain carbohydrates and calories, which will raise blood glucose levels, rendering the fasting result inaccurate. For example, if a patient admits to having juice or sweetened tea before a fasting glucose test, you must inform them the test cannot be performed accurately and must be rescheduled. Always ensure strict adherence to fasting instructions to obtain valid test results. Question 18. What is the correct way to identify a comatose or unconscious patient before a blood draw? A. Ask the patient's family member for their name and date of birth. B. Check the patient's wristband against the requisition form. C. Check the patient's chart for their recent vital signs. D. Ask the nurse on duty for verbal confirmation of the patient's identity. Answer: B. Check the patient's wristband against the requisition form. This question addresses a critical scenario in patient identification when the patient cannot verbally communicate. The key phrases comatose or unconscious patient highlight the need for alternative, reliable identification methods. For these patients, the primary method is to compare the information on their identification wristband, full name, date of birth, medical record number, with the information on the requisition form for the blood draw. For example, if you enter a patient's room and they are unresponsive, you would check their wristband and match it precisely with your paperwork before proceeding. Always rely on physical identifiers like wristbands for nonverbal patients to ensure correct patient identification. Question 19. A phlebotomist observes petechiae forming around the venipuncture site during a blood draw. What is the most likely cause? A. The tourniquet was applied for too long. B. The needle gauge was too small. C. The patient has a clotting disorder. D. The phlebotomist performed an improper insertion. Answer: A. The tourniquet was applied for too long. This question tests your ability to identify the cause of specific venipuncture complications. The concept is related to capillary fragility and blood vessel integrity. Petechiae are small red spots that appear on the skin, indicating pinpoint hemorrhages. They are most commonly caused by leaving the tourniquet on for an extended period, typically over 1 minute, which increases capillary pressure and can lead to minor leakage of blood into the skin. For instance, if you're having trouble finding a vein and the tourniquet has been on for several minutes, you might start to see these tiny red dots appear. Always release the tourniquet within 1 minute to prevent complications like petechiae and hemoconcentration. Question 20. Which tube additive prevents coagulation by binding calcium? A. Sodium citrate. B. Heparin. C. EDTA. D. Sodium fluoride. Answer: C. EDTA. This question focuses on the specific mechanism of action for different anticoagulant additives used in blood collection tubes. The concept is how various substances prevent blood from clotting. The keyword binding calcium is the crucial clue. Ethylenediamine tetrashic acid, EDTA, commonly found in lavender top tubes, prevents coagulation by chelating, binding, calcium ions, which are essential cofactors in the coagulation cascade. For example, when you collect a CBC in a lavender tube, the EDTA binds the calcium, stopping the clotting process and preserving the blood cells. Always remember that EDTA works by binding calcium, thus preventing the blood from clotting. Question 21. A phlebotomist is preparing to collect a blood culture using a winged infusion set, butterfly needle. Which bottle should be inoculated first? A. Anaerobic bottle. B. Aerobic bottle. C. Either bottle, it does not matter. D. The blood culture should be collected using a syringe only. Answer: B. Aerobic bottle. This question addresses a specific aspect of blood culture collection technique, particularly when using a butterfly needle. The concept relates to air contamination in the collection system. The keyword winged infusion set or butterfly needle is the key. When using a butterfly needle, the tubing attached to it contains a small amount of air. To prevent this air from entering and potentially inhibiting the growth of anaerobic bacteria, the aerobic, air-loving, bottle should be inoculated first, allowing the air to be flushed out of the tubing before the anaerobic bottle is filled. For instance, if you're using a butterfly to draw blood for cultures, always fill the blue-capped aerobic bottle first, then the purple-capped anaerobic bottle. Always remember to fill the aerobic bottle first when using a butterfly to clear any air from the tubing. Question 22. A phlebotomist needs to collect blood from a patient for a prothrombin time, PT, test. Which tube color is required for this test? A. Red. B. Lavender. C. Light blue. D. Green. Answer: C. Light blue. This question tests your knowledge of specific laboratory tests and their corresponding tube colors. The concept is matching the right additive to the required test for accurate results. The keyword prothrombin time, PT, is the direct clue. PT tests, along with PTT, partial thromboplastin time, are coagulation studies that require a sodium citrate additive to preserve the clotting factors. This additive is found in light blue top tubes. For example, if an order specifies a PT/INR, you'll immediately reach for the light blue tube, knowing it contains the correct anticoagulant for coagulation testing. Always associate light blue tubes with coagulation studies like PT and PTT. Question 23. After drawing blood, the phlebotomist should engage the safety mechanism on the needle and immediately place it into which of the following? A. A regular trash can. B. A biohazard bag. C. A puncture-resistant sharps container. D. A labeled specimen transport bag. Answer: C. A puncture-resistant sharps container. This question addresses the critical safety procedure for disposing of used needles, aiming to prevent needle stick injuries. The concept is sharp safety and proper waste management. The key phrases are engage the safety mechanism and immediately place it into. Used needles, even with safety features engaged, must be disposed of in a specifically designed, puncture-resistant sharps container at the point of use to prevent accidental needle sticks. For instance, right after withdrawing the needle from the patient's arm, you should activate its safety feature and drop it directly into the yellow sharps container nearby. Always prioritize sharps safety by immediately disposing of needles in appropriate containers to protect yourself and others. Question 24. A patient has a burn injury on their left arm, making it unsuitable for venipuncture. Their right arm has extensive scarring from previous surgeries. Which site would be the most appropriate alternative? A. The hand veins on the right arm. B. The antecubital fossa of the left arm, avoiding the burn. C. A dorsal hand vein on the left arm. D. The foot or ankle vein. Answer: A. The hand veins on the right arm. This question challenges your ability to find alternative venipuncture sites when conventional ones are compromised. The concept is site selection adaptation based on patient conditions. The keywords burn injury on left arm and extensive scarring on right arm indicate that both antecubital areas are compromised. In such cases, if the antecubital veins are not accessible, hand veins are the next preferred site. While foot veins are an option, they are generally avoided unless absolutely necessary due to higher risks of complications like phlebitis or infection, especially in patients with diabetes or peripheral vascular disease. For example, if both antecubital areas are unusable, gently check the back of the hand for accessible veins, as they are often more visible than scarred forearm veins. Always move to the next best alternative site, prioritizing patient safety and comfort. Question 25. What is the primary purpose of palpating a vein before venipuncture? A. To determine the patient's pain tolerance. B. To assess its depth, direction, and bounce. C. To check for any underlying arterial pulsations. D. To cleanse the site more thoroughly. Answer: B. To assess its depth, direction, and bounce. This question addresses a fundamental skill in venipuncture: vein palpation. The concept is using touch to locate and evaluate suitable veins. The keyword primary purpose directs you to the most important reason for this action. Palpation helps the phlebotomist to see the vein with their fingertips, feeling for its depth, its path, and its resilience, how bouncy it is, which guides successful needle insertion. For instance, after applying the tourniquet, you would gently feel the antecubital area with your index finger to find a vein that feels like a rubbery tube and you can trace its path. Always remember that palpation is essential for selecting a good vein, not just seeing it. Question 26. A phlebotomist is unable to obtain blood flow after inserting the needle. The patient denies pain. What should the phlebotomist do first? A. Withdraw the needle and try a new site. B. Gently redirect the needle. C. Ask the patient to clench their fist. D. Advance the needle further. Answer: B. Gently redirect the needle. This question tests your problem-solving skills when a venipuncture attempt is unsuccessful. The concept is troubleshooting poor blood flow while the needle is still in the patient's arm. The keyword first is crucial, and the absence of pain suggests the needle isn't causing discomfort or nerve damage. If blood flow doesn't start, the needle might be slightly off the vein, partially through it, or against a valve. A gentle, slight redirection, without probing excessively, is often the first logical step to try and enter the vein lumen before fully withdrawing and trying a new site. For example, if you insert the needle and get nothing, a slight adjustment to the angle or direction of the needle might be all it takes to get blood flowing. Always attempt gentle redirection as your initial troubleshoot if the patient is comfortable and you suspect the vein is nearby. Question 27. Which of the following is an example of an analytical error in phlebotomy? A. Incorrect patient identification. B. Drawing blood from the wrong site. C. Failure to mix the tube properly after collection. D. Transporting a specimen at the wrong temperature. Answer: D. Transporting a specimen at the wrong temperature. This question tests your understanding of the phases of laboratory testing and where errors can occur. The concept distinguishes between pre-analytical, analytical, and post-analytical errors. Analytical error specifically refers to errors that occur during the actual testing phase in the laboratory. While specimen transport happens before the test is run, proper transport conditions are crucial for specimen integrity, and failing to maintain the correct temperature directly impacts the quality of the analytical result, often grouped under the broader analytical umbrella in terms of impacting the final result's accuracy. Incorrect patient identification, drawing from the wrong site, and improper mixing are all pre-analytical errors. For instance, if a cold agglutinin sample is transported without being warmed, the test result will be inaccurate, which is considered an analytical issue because it compromises the test itself. Always recognize that proper specimen handling, including temperature, is vital for accurate analytical results. Question 28. A phlebotomist is preparing to collect a blood sample for an ammonia level. How should this specimen be handled immediately after collection? A. Protected from light. B. Placed on ice and transported immediately. C. Warmed to 37 degrees Celsius. D. Centrifuged within 10 minutes. Answer: B. Placed on ice and transported immediately. This question assesses your knowledge of special handling requirements for specific laboratory tests. The concept here is maintaining the stability of analytes. The keyword ammonia level is the crucial clue. Ammonia in blood is unstable and rapidly increases at room temperature due to metabolic processes. To slow down these processes and ensure an accurate result, the specimen must be placed on ice immediately after collection and transported quickly to the lab. For example, after drawing an ammonia tube, you would immediately place it into a slurry of ice and water for transport. Always remember that ammonia samples require chilling to preserve their integrity. Question 29. What is the primary reason for inverting blood collection tubes immediately after collection? A. To prevent clot formation in tubes with anticoagulants. B. To prevent hemolysis of the red blood cells. C. To activate the clot activator in serum separator tubes. D. To ensure proper mixing of the additive with the blood sample. Answer D. To ensure proper mixing of the additive with the blood sample. This question addresses a critical step in proper specimen handling. The concept is ensuring the additives in the tube work correctly to maintain specimen integrity. The keyword primary reason emphasizes the most important purpose. Inverting tubes gently, usually 5 to 8 times, depending on the tube type, immediately after collection ensures that the anticoagulant or clot activator is thoroughly mixed with the blood sample, preventing microclot formation in anticoagulant tubes or ensuring proper clotting in serum tubes. For example, if you collect a CBC in a lavender tube, you must gently invert it several times right away to mix the EDTA and prevent the blood from clotting, otherwise, the lab can't analyze it. Always ensure tubes are gently inverted immediately after collection to ensure proper additive blood mixing and accurate results. Question 30. A phlebotomist must collect blood from a patient with a known history of fainting, vasovagal syncope. Which of the following is the most important precaution to take? A. Use a smaller gauge needle. B. Have the patient lie down during the draw. C. Apply the tourniquet for a shorter duration. D. Instruct the patient to look away from the needle. Answer B. Have the patient lie down during the draw. This question focuses on managing a specific patient complication, a history of fainting. The keyword most important precaution guides you to the action that best prevents syncope and ensures patient safety. Having the patient lie down during the draw is the most effective way to prevent injury should they faint, as it minimizes the distance they could fall and reduces the risk of head trauma. For example, if a patient tells you they've fainted before, you should immediately suggest they lie on the exam table or in a reclining chair for the blood draw. Always prioritize patient safety by positioning them to prevent falls if they have a history of fainting. Question 31. Which angle of needle insertion is typically recommended for venipuncture in the antecubital area? A. 5 to 10 degrees. B. 15 to 30 degrees. C. 45 degrees. D. 90 degrees. Answer B. 15 to 30 degrees. This question tests your knowledge of proper venipuncture technique, specifically the correct angle of needle insertion. The concept is finding the optimal angle to enter the vein without going through it or missing it. The recommended angle for routine venipuncture in the antecubital fossa is typically 15 to 30 degrees relative to the skin surface. This angle allows for smooth entry into the vein lumen without excessive tissue trauma or piercing through the back wall of the vein. For instance, when you insert the needle, aim for a low angle, just enough to puncture the skin and vein, often about the angle of a shallow slope. Always ensure your needle insertion angle is within the 15 to 30 degree range for optimal vein access. Question 32. What is the maximum amount of time a tourniquet should remain on a patient's arm during venipuncture? A. 30 seconds. B. 1 minute. C. 2 minutes. D. 5 minutes. Answer B. 1 minute. This question assesses your knowledge of proper tourniquet application time, which is critical for preventing complications and ensuring accurate test results. The concept is avoiding hemoconcentration and minimizing patient discomfort. The keyword maximum amount of time highlights the strict limit. Leaving a tourniquet on for longer than 1 minute can lead to hemoconcentration, an increase in the concentration of blood components due to fluid loss into the tissues, and can also cause discomfort or even petechiae. For example, if you can't find a vein within a minute, release the tourniquet, have the patient relax their arm, and then reapply it if needed. Always release the tourniquet within 1 minute to ensure accurate results and prevent complications. Question 33. A phlebotomist accidentally punctures an artery instead of a vein. Which of the following observations would most likely indicate this complication? A. The blood is dark red and flows slowly. B. The blood is bright red and pulsates into the tube. C. The patient reports a burning sensation. D. A large hematoma forms rapidly at the site. Answer: B. The blood is bright red and pulsates into the tube. This question tests your ability to differentiate between arterial and venous blood and recognize an accidental arterial puncture. The concept here is understanding the distinct characteristics of blood from arteries versus veins. The key clues are bright red and pulsates. Arterial blood is bright red due to its high oxygen content and will typically pulse into the tube because it is under higher pressure directly from the heart, unlike the steady, darker flow of venous blood. For example, if you see the blood coming out in spurts and it's a very vivid red, that's a strong sign you've hit an artery. Always remove the needle immediately and apply firm pressure for at least 5 minutes if an arterial puncture is suspected. Question 34. After collecting blood samples, the phlebotomist notices that one of the tubes, a lavender top, is underfilled. What is the most likely consequence of this error? A. Hemolysis of the sample. B. Clotting of the sample. C. Elevated potassium levels. D. Inaccurate coagulation results. Answer: B. Clotting of the sample. This question addresses the consequences of an underfilled tube, particularly one with an anticoagulant. The concept is the critical blood-to-additive ratio. The keyword underfilled for lavender top, which contains EDTA, an anticoagulant, is crucial. If there isn't enough blood for the amount of anticoagulant in the tube, the anticoagulant-to-blood ratio will be disproportionate. This excess anticoagulant can cause the blood to clump or clot, making the sample unusable for tests like a CBC, which requires whole, unclotted blood. For example, if a lavender tube is only half filled, the high concentration of EDTA compared to the blood can cause the red blood cells to shrink or the blood to clot. Always ensure tubes are filled to the correct volume to maintain the proper blood-to-additive ratio and prevent clotting or other issues. Question 35. A patient has a latex allergy. Which supplies should the phlebotomist ensure are not used during the venipuncture procedure? A. Alcohol pads. B. Tourniquet. C. Adhesive bandage. D. Evacuated tube holder. Answer: B. Tourniquet. This question focuses on patient safety and managing allergies during phlebotomy. The concept is identifying potential allergens in common phlebotomy supplies. The keyword latex allergy points directly to materials made from natural rubber latex. While many medical products are now latex-free, traditional tourniquets can still contain latex. It's crucial for phlebotomists to be aware of and use latex-free alternatives, like synthetic rubber or Velcro-type tourniquets, for patients with a known allergy. For example, if a patient mentions they are allergic to latex, you would avoid using a standard rubber tourniquet and instead use a latex-free band or cuff. Always verify and use latex-free supplies for patients with latex allergies to prevent severe reactions. Question 36. Which of the following tests requires protection from light immediately after collection? A. Bilirubin. B. Blood glucose. C. Complete blood count, CBC. D. Prothrombin time, PT. Answer: A. Bilirubin. This question tests your knowledge of specific specimen handling requirements that impact test accuracy. The concept is preserving light-sensitive analytes. The keyword protection from light is the direct clue. Bilirubin, especially in infants, is highly sensitive to light degradation. Exposure to light can cause the bilirubin to break down, leading to a falsely decreased result. Therefore, specimens for bilirubin testing must be protected from light by wrapping the tube in aluminum foil or using an amber-colored tube immediately after collection. For example, after drawing a bilirubin tube from a newborn, you would quickly wrap it in foil to keep it from light. Always remember to shield bilirubin samples from light to ensure accurate results. Question 37. What is the primary purpose of the accession number assigned to a patient's specimen? A. To identify the patient's insurance information. B. To track the specimen throughout the laboratory process. C. To determine the specimen's collection time. D. To indicate the ordering physician. Answer: B. To track the specimen throughout the laboratory process. This question addresses a key aspect of specimen management in the laboratory. The concept is specimen identification and traceability. The keyword primary purpose focuses on the main function of this unique identifier. An accession number is a unique tracking number assigned to each specimen upon receipt in the lab. It allows the lab to accurately track the specimen from the moment it enters the system through testing and reporting, ensuring results are linked to the correct sample and patient. For example, if you send a sample to the lab, its accession number is like a barcode that helps the lab keep track of it every step of the way until results are released. Always recognize the accession number as the unique identifier that ensures specimen traceability and integrity. Question 38. A phlebotomist observes that the patient's arm is cold to the touch and the vein is difficult to palpate. What is the most appropriate action to improve venous access? A. Apply a warm compress to the site. B. Use a larger gauge needle. C. Apply the tourniquet more tightly. D. Have the patient pump their fist vigorously. Answer: A. Apply a warm compress to the site. This question assesses your problem-solving skills when encountering difficult venipuncture conditions. The concept is enhancing venous distension. The keywords cold to the touch and difficult to palpate suggest vasoconstriction, narrowing of blood vessels. Applying a warm compress to the venipuncture site for a few minutes can cause vasodilation, increasing blood flow to the area and making veins more prominent and easier to palpate and access. For example, if a patient's veins are rolling or just hard to feel, placing a warm pack on their arm for 5 to 10 minutes can make a big difference. Always remember that warming the site can significantly improve venous distension for difficult draws. Question 39. Which gauge needle has the largest lumen? A. 23 gauge. B. 21 gauge. C. 18 gauge. D. 25 gauge. Answer: C. 18 gauge. This question tests your understanding of needle gauge sizes and their inverse relationship to lumen size. The concept is that a smaller gauge number indicates a larger needle diameter, lumen. The keyword largest lumen directly asks for the biggest opening. Among the choices, an 18 gauge needle has the smallest numerical value, meaning it has the widest diameter and therefore the largest lumen, commonly used for blood donations or rapid fluid infusion rather than routine venipuncture. For example, a 23 gauge needle is very thin, whereas an 18 gauge needle is noticeably thicker. Always remember that the lower the gauge number, the wider the needle's opening. Question 40. A phlebotomist must verify that a patient has fasted for 12 hours prior to drawing blood for which of the following tests? A. Complete blood count, CBC. B. Basic metabolic panel, BMP. C. Thyroid stimulating hormone, TSH. D. Prothrombin time, PT. Answer: B. Basic Metabolic Panel, BMP. This question tests your knowledge of specific fasting requirements for common laboratory tests. The concept is how food intake can affect certain blood analytes. The keyword fasted for 12 hours is the crucial clue. A basic metabolic panel, BMP, typically includes glucose and sometimes other analytes, like BUN or creatinine, that can be significantly influenced by recent food or drink intake. Therefore, a fasting state is usually required for an accurate BMP. While a CBC, TSH, and PT generally do not require fasting, glucose in a BMP is sensitive to recent food. For example, if a patient is scheduled for a BMP, you would confirm they haven't eaten or had sugary drinks for 8 to 12 hours prior to the draw. Always confirm fasting status for tests like glucose, cholesterol, and BMPs to ensure accurate results. Question 41. What is the main concern if a phlebotomist draws blood from above and fore insertion site? A. Hemolysis of the sample. B. Risk of nerve damage. C. Dilution of the blood sample. D. Collapse of the vein. Answer: C. Dilution of the blood sample. This question addresses the dangers of drawing blood from an arm with an active fore. The concept is maintaining specimen integrity. The keywords above and fore insertion site highlight the risk of drawing blood that is contaminated with the intravenous fluids. Drawing proximal to, above, an active fore means you are likely collecting blood that is diluted by the fore solution, leading to inaccurate test results. For example, if a patient has an fore running in their forearm, and you draw above it, the blood sample might have lower concentrations of certain analytes because of the fore fluid mixing with the blood. Always avoid drawing above an active fore to prevent sample dilution and inaccurate results. Question 42. A phlebotomist is preparing to perform a venipuncture on a patient with a known needle phobia. What is the most therapeutic approach to minimize anxiety? A. Tell the patient to just relax and look away. B. Describe the entire procedure in detail, including potential pain. C. Engage the patient in conversation about a non-medical topic. D. Rush through the procedure to get it over with quickly. Answer: C. Engage the patient in conversation about a non-medical topic. This question focuses on patient care and managing anxiety, specifically for those with needle phobia. The concept is using therapeutic communication to distract and calm the patient. The keyword most therapeutic approach emphasizes the best way to help. Engaging the patient in light, non-medical conversation acts as a distraction technique, shifting their focus away from the procedure and their anxiety, which can significantly reduce their stress. For instance, if a patient is anxious, you might ask them about their favorite hobbies or plans for the weekend, helping them feel more at ease. Always use distraction and empathetic communication to make the experience more comfortable for anxious patients. Question 43. After collecting a stat specimen, what is the most important step for timely delivery to the lab? A. Place the specimen in the regular outgoing lab rack. B. Ensure the specimen is properly labeled and immediately transport it. C. Call the lab to inform them a stat specimen is on its way. D. Centrifuge the specimen immediately upon collection. Answer: B. Ensure the specimen is properly labeled and immediately transport it. This question addresses the critical process for handling stat specimens, which require rapid turnaround. The concept is prioritizing speed and accuracy for urgent tests. The keywords stat specimen and most important step emphasize the need for prompt action. While calling the lab might be done, the absolute most crucial and immediate action is to ensure proper labeling for patient identification, and then transport it directly to the lab without delay, bypassing routine collection schedules. For example, after drawing a stat cardiac enzyme, you would immediately label the tube and personally deliver it to the lab or ensure it's picked up by the fastest method. Always prioritize immediate and direct transport for stat specimens after proper labeling. Question 44. A patient has significant edema, swelling, in both arms. Which action should the phlebotomist take when selecting a venipuncture site? A. Attempt to draw from the most swollen area. B. Avoid edematous areas entirely and consider alternative sites like the hand or foot. C. Apply the tourniquet tighter than usual to displace the fluid. D. Massage the edematous area vigorously to reduce swelling. Answer: B. Avoid edematous areas entirely and consider alternative sites like the hand or foot. This question focuses on adapting venipuncture techniques for patients with edema. The concept is that swollen areas are unsuitable for blood collection due to compromised specimen quality and increased patient risk. The keyword significant edema indicates that fluid buildup can dilute the blood sample, making results inaccurate, and the fluid makes veins harder to find and prone to rolling. Therefore, the phlebotomist should avoid these areas completely and seek unaffected sites, such as the back of the hand or, if necessary and permitted, foot veins. For example, if a patient's arm is puffy and soft due to swelling, you should search for a less swollen area or a hand vein. Always choose a non-edematous site to ensure accurate results and a safer draw. Question 45. What is the term for the breakdown of red blood cells, which can occur if a blood sample is shaken too vigorously? A. Hemoconcentration. B. Hemolysis. C. Hemostasis. D. Hematoma. Answer: B. Hemolysis. This question tests your understanding of a common pre-analytical error and its consequence. The concept is the integrity of red blood cells in a blood sample. The keywords breakdown of red blood cells and shaken too vigorously directly point to hemolysis. Hemolysis is the rupture or destruction of red blood cells, releasing hemoglobin into the serum or plasma. Vigorous shaking, or other improper handling like using too small a needle or drawing too slowly, can cause red cells to burst, leading to inaccurate test results, particularly for potassium. For example, if a tube of blood looks reddish or pinkish in the serum portion after spinning, it's likely hemolyzed. Always handle blood specimens gently to prevent hemolysis and ensure accurate lab results. Question 46. What is the purpose of anchoring the vein during venipuncture? A. To make the insertion less painful for the patient. B. To prevent the vein from rolling and moving. C. To apply pressure after the draw. D. To cleanse the site more effectively. Answer: B. To prevent the vein from rolling and moving. This question addresses a fundamental technique in venipuncture for achieving successful vein access. The concept is stabilizing the vein during needle insertion. The keyword anchoring refers to the action of pulling the skin taut below the intended insertion site with the thumb of your non-dominant hand. This action stabilizes the vein, preventing it from rolling or moving away from the needle tip during insertion, which is crucial for a successful and less traumatic draw. For example, just before inserting the needle, you would pull the skin downwards firmly below the chosen vein to keep it in place. Always anchor the vein properly to prevent it from rolling and ensure a smooth venipuncture. Question 47. A phlebotomist must collect a blood alcohol, ethanol, level. Which antiseptic should not be used for site preparation? A. Povidone iodine. B. Chlorhexidine gluconate. C. Isopropyl alcohol. D. Benzalkonium chloride. Answer C. Isopropyl alcohol. This question tests your knowledge of specific test requirements that dictate antiseptic choice. The concept is avoiding contamination of the sample with substances that are being tested for. The key phrase blood alcohol, ethanol, level is the direct clue. Since alcohol is the analyte being measured, using an alcohol-based antiseptic like isopropyl alcohol for site preparation would introduce alcohol into the sample, leading to a falsely elevated result. Instead, non-alcohol-based antiseptics such as povidone iodine or chlorhexidine gluconate should be used. For example, if you're doing a legal blood alcohol draw, you must use a non-alcohol wipe like betadine to clean the arm. Always avoid alcohol-based antiseptics when collecting blood alcohol levels to ensure accurate results. Question 48. Which organization sets the standards for phlebotomy procedures, including order of draw and venipuncture technique? A. OSHA. B. CDC. C. CLSI. D. HIPAA. Answer C. CLSI. This question assesses your knowledge of key regulatory and standard-setting bodies in healthcare. The concept is understanding who establishes best practices for laboratory procedures. The acronym CLSI stands for Clinical and Laboratory Standards Institute. CLSI is a global, nonprofit standards-developing organization that publishes consensus standards and guidelines for various laboratory procedures, including phlebotomy, which are widely recognized and followed in the medical community. OSHA deals with workplace safety, CDC with public health, and HIPAA with patient privacy. For example, the order of draw guidelines you follow are directly from CLSI recommendations. Always refer to CLSI guidelines for the most up-to-date and standardized phlebotomy practices. Question 49. A phlebotomist has just received a stat order for a glucose tolerance test, GTT. What is the appropriate initial action? A. Collect the fasting blood sample immediately. B. Administer the glucose beverage to the patient. C. Verify that the patient has fasted and explain the procedure. D. Ask the patient if they have any history of diabetes. Answer C. Verify that the patient has fasted and explain the procedure. This question tests your understanding of the initiation of a glucose tolerance test, GTT, even under stat conditions. The concept is proper patient preparation and education for a timed test. The keywords stat order for a glucose tolerance test, GTT, indicate urgency, but the GTT is a multi-step, time-sensitive test that requires a fasting baseline. Therefore, the most appropriate initial action is to confirm the patient's fasting status and thoroughly explain the entire procedure, including the timing of blood draws and the consumption of the glucose beverage. For example, before you even think about drawing blood or giving the drink, you need to confirm they've been fasting and explain that it's a multi-hour test. Always prioritize confirming patient preparation and providing clear instructions for multi-stage tests like a GTT. Question 50. If a patient experiences nausea and vomiting during a blood draw, what should the phlebotomist do first? A. Give the patient a basin or emesis bag. B. Immediately discontinue the draw. C. Loosen the tourniquet and apply a cold compress to their forehead. D. Document the incident in the patient's chart. Answer B. Immediately discontinue the draw. This question presents a common patient adverse reaction during venipuncture and asks for the immediate priority. The concept is patient safety and preventing aspiration or further distress. The keywords nausea and vomiting indicate a significant adverse reaction that requires immediate attention. Your primary responsibility is to ensure patient safety, so the draw must be discontinued immediately by removing the needle and tourniquet to prevent accidental injury during a sudden movement or aspiration during vomiting. For example, if a patient suddenly looks green and says they're going to throw up, your first move is to pull the needle out and remove the tourniquet. Always prioritize stopping the procedure immediately at the first sign of severe patient distress like nausea or vomiting.